Welcome everybody to this LinkedIn, YouTube, and Instagram Live. I'll be talking to Dr. Jill McGarry, who's a clinical psychologist with a real expertism within sleep. This one's going to be super interesting because we're going to be talking about dreams, nightmares, night terrors, and everything around this area, which I think everyone has dreams. Everyone talks about it. Everyone's interested in it, but very, very few people actually understand the details and the science of it. And there's a lot to be talked about. A lot of people have issues with nightmares. A lot of people want to improve their lives and understand what's happened in their dreams. So no longer delaying, I'll invite Jill to the stage.
Thank you very much.
Good to have you here today. I'm very excited. And a quick note to the audience, we'll be doing about 30 minutes of questions I've already been asked prior to ask you. And then we'll allow 10 minutes towards the end to answer any questions any people watching us live would like to have. So if you have a question, just type in the comments and we'll happily answer it. I'll leave you to quickly introduce yourself, Jill, and I've got a quick question to kick off as soon as you do that.
Okay, so yeah, hi everyone. Thank you very much for inviting me, Matt. We've had quite a few conversations, haven't we, about dreams and other things, so it's great to have this moment, but only half an hour to talk is going to be so small. Definitely could do a lot longer, but really interested to know what the questions are going to be, all those personal bits.
All right. Well, I mean, first of all, we all have dreams, but what are they? And I appreciate it's a very subjective area, but what in simple terms are dreams?
Mm-hmm. So we think it's a subjective area, but actually there's more data out there than ever. I think we've got clever devices now, PSGs, that we can put on people's brains, so we can actually see what's happening, and therefore we know a lot more. But we've also got some really clever neurosurgeons that when they've been operating on people and they need to cut into the brain to get rid of a tumor, they've actually, I'd call it, stumbled upon the areas where the dreams come from. And they've activated dreams during a surgery, because what they need to do is find parts in the brain where there is no neuroactivity and it's safe to cut. And so they test lots of areas. So the person has to be awake, but they touch these zones and all of a sudden the person says, that's one of my dreams. And so they know not to cut there, but it's quite interesting. So our brains are really clever, and our dreaming comes from our brains. It also makes sense that our bodies have evolved and our brains have evolved in a way that means we're constantly choosing the parts of our characteristics that are beneficial for us and getting rid of the bits that aren't. So to know that we dream for quite a chunk of the night means that it's really beneficial to us. And to know why it's beneficial to us, there are theories. We don't have any proven evidence, but we think that teenagers sleep for longer because they need to dream more. Because what happens in dreaming is that we're fine-tuning the things that have happened during the day. And what teenagers do is more than just fine-tuning what happened during the day. They're actually pruning their brains, is what's happening during that stage. And so the whole of the brain, it's kind of like sleep is like doing lots of things physically for our bodies. It's washing out our toxins and our hormones, rebalancing our leptin and ghrelin, repairing our muscles. But we think also that emotionally it's doing a lot of work as well around tuning into the emotions, the issues that have happened during the day. And we think that, what would I describe it as, our reactions to threats get reconsidered in dreams. Because when we're dreaming, our bodies, in the main part of dreaming, the most intense part of dreaming, which is called REM. Sorry, I'm probably getting a bit too technical too soon. But when we're dreaming in our main intense moment, then we're being able to think through some really intense threat moments we've had during the day or during the month. But our bodies can't react. Our bodies are paralyzed, apart from our breathing and our eyes. That's why we call it rapid eye movement. So our cortisol and adrenaline doesn't get pumped. So we can think about the problems we've had without the reaction, so we can do more lateral thinking. But the other clever thing about when we're asleep, and we know this again because of those machines we can put on people's heads, is the frontal lobe isn't on. So all our logic and all our planning and sequencing is switched off, and our imagination part of the brain is in superflow. So you can imagine all the problems, all that lateral thinking comes to the forefront. So quite a few music artists have said they wrote some of their great songs because it's a creative time as well. Did that make sense, Matt? I think I went on into specifics.
I mean,
it might be difficult.
It sounds to me like, obviously, like we are getting better understanding the science. I think we know when people are dreaming, and we're starting to understand what parts of the brain are responsible for that. One question I have that I hadn't pre-prepared at all, but I heard that children, when they're very young, quite often have dreams about things like wolves, bears, predators. In theory, things they've never even seen. And then as we get older, we dream more about what's happening in our lives, which would indicate that dreaming is just a simulation to prepare us for the world.
Yes.
But that's my big assumption based on hearsay. So tell me.
Yeah, so the science shows us that children they walk and they talk before they dream. There is no dreaming until they can walk or talk. And it's only when the visuospatial part of their brain begins to develop that they then to have dreams. And then those dreams can turn into nightmares. So most kids have nightmares. And that's because they're trying to work out or develop their sense of self. That's really important. Dividing them from other things or other people. So before they start dividing themselves from other people, they're dividing themselves from other things. So it's very, very common. It is that they dream before the visual spatial part comes in, that they might have photographic snapshots of something. So there might be, a wolf or a monster, but it's not got a story to it. It's not until those parts of the brain where you can tell a story that it actually begins to have more detail to it or a story to it. But yeah, it is very common that they do dream. My daughter, in fact, my second daughter, she had night terrors when she was a baby. We were like, what is going on? Why is she screaming out at night? And we put her in her own bedroom earlier than we would have wanted. So we're a little bit worried about, being on her own and all that death cot syndrome. But we thought that getting enough sleep was really important. And what I think was going on is she was hearing me and my husband snoring. And that would be quite frightening to a baby when they wouldn't have heard it during the day. I don't know, but it does happen. But we don't know enough yet. Some things we know lots about, and some things we're just trying to analyze.
Interesting. How come is it that we sometimes remember dreams and then sometimes we don't?
Oh, that's a really good question. And I think it's also a question about how come sometimes we dream and some people say they don't dream, and how do some other people dream loads and remember loads of detail? And the evidence is getting stronger to suggest that we can, what's the word for it, train ourselves to remember more. So we can have like a pad by the side of your bed. And if you wake up and you can help yourself write down the dream the second you wake up, you'll remember more of the detail than you will do if you went to the loo or opened the curtains or whatever, or you looked at your phone. It will have gone. Pen and paper by the side of the bed will help you remember more of your dreams. However, people, they all dream. What we do know is that we do less intense dreaming at the beginning of the night and on our most intense dreaming just before we wake up, if we get a good block of sleep in one go. It makes sense that evolutionarily wise, we did the dreaming at the end because we're going 4 stages of sleep, and N1 is dropping off sleep, N2 is light sleep when you might be woken up by noises, and N3 is deep sleep, and that's when our memory is recovering, our body's recovering, our hormones are. So it made sense evolutionarily wise. We were doing all of that before we got to the 4th one, the REM sleep, which is the main intense dreaming part. Because if we're not recovered physically, we're not going to be able to get away from the lions and tigers the next day. So it was important we recovered physically first, and then emotionally, it'd be great if we could do that as well. So if you look at the 4 stages, they go in nice little waves like that. And we do that wave about 4 or 5 times in the night, depending on how much sleep you get. And so one wave is one lot of 4 stages and then another. But each one of those is made up of a different amount. And the last wave has got a bigger chunk of REM in it. Have I explained that sufficiently? Don't know. So yeah, so the other thing you asked about was why do you have more sometimes and less other times? Well, because dreams are often a replay of things that you've got issues with during the day, then the more you're aligned to that, the more likely you are to wake up either in a dream or after. And that's because if we're doing this swim, I call it a swim. Michael Mosley described our sleep at night a bit like being a seal. So to begin with, we're awake, we're on the surface of the water, and then we do deep dives. And REM sleep is quite close to the top, quite close to the surface. So wakefulness, so you're close to wakefulness about four or five times during the night. So if you're going to have a REM sleep, you've got 4 or 5 opportunities to remember that dream.
Interesting. So I'm right, I think, like if you wake up, let's say if you wake up close to your dreams, you're basically more likely to remember them.
You won't remember them if you don't wake up in a REM sleep or just at the end of a REM sleep or just at the start. You will not remember them.
Yeah.
If you're in deep sleep or N1 or N2, the light sleep and falling off sleep, you won't remember them.
Interesting.
But also, sorry, when I talk about dreams, I'm talking about REM dreams, and they're the most intense ones, the ones that are the most vivid and aligned to you. But the research is showing that actually we do partial dreaming in all the other stages as well. They're just not as intense or as relevant or as big an issue.
I see. Going back, because you mentioned it's normal to have nightmares, I believe so. Like, are nightmares normal? And should we be worried about them or not?
So nightmares are normal for kids. It's a part of developing the self is what we think is what's happening there. So to be able to talk to your kids about dreams, because if you were to say they're not real, you have to have that understanding about what reality is and what isn't reality. And that's quite hard for kids. So to have that conversation with a child to help her develop or even to develop that skill of understanding what's real or not real, how to categorize, is it a monster or isn't it a monster? So to really have a conversation about the nightmare would be important. As adults, though, we have nightmares less than when we did kids because we're no longer developing that sense of self, and our imagination isn't as what would you describe? So teenagers, they're, like I said, they're pruning their brains all the time to decide which bits of information to keep and which not. So I suppose our brains aren't as actively imaginative as we are when we're kids.
Interesting. And I had someone message me quite recently, and I think it's not, I know it's condition specifically related to this, but there are people who have recurring nightmares, and it seems to be causing them to wake up and causing them to have disrupted sleep. And I imagine you probably quite often have clients, patients with this exact problem. So is there any sort of like low-key advice you would give to people who are having destructive nightmares, and maybe some little steps that they can do?
Yeah, first of all, is to say that the nightmares is being constructive. It is your brain emotionally trying to work through some issues that are going on for you at the moment. So you shouldn't fear it. You should almost do, like I said for kids before, really look at it, really explore it. Those people that try and analyze dreams, they're looking at things very generally, whereas you should be looking about what's happening in your life, what's making your brain decide it wants to think of some lateral solution to a problem, and that's why I'm having a nightmare. It's very common with people that got post-traumatic stress disorder. It's one of the criteria for diagnosing, in fact, is to have nightmares. And that means your brain's just uber good at night at trying to work through the trauma. You're not managing to do it during the day. There's still some parts of it that haven't been solved or putting it in a place that makes it feel healthier, and it's still trying to work it out. So the first thing is to say, oh my God, my brain is doing an amazing job, because I think that's what happens with nightmares, is people go, I just want to get rid of them, and they don't engage with them. Whereas actually to do the opposite is really, really healthy. and then to really think about what the details are. So people might go, oh, I know the details, I remember it, it's not like a dream, but really writing down every single detail on a piece of paper can be great, because you won't forget it, but also you can do that analysis a bit better. But it means that you're actually going to start working on the issue during the day as well as during the night when you're asleep, because you've written it down. And then for those that have more persistent, more sleep depriving nightmares, that means it's becoming like a real chronic problem, then we would do a thing that is called imagery rehearsal. And we would take that idea of writing it down to the next level. We would make them write it down in fine detail, maybe on several sheets of A4 paper. So the idea of writing is really helpful. But to maybe even write it down 2 or 3 times. So it's really going into the brain, so they're really thinking about it. But then continue the story in the daytime. So the end story is never death. We never dream of actually dying. We might dream of health problems, and there are some core things that we dream about, and one of them is a health problem, or, like I said before, a traumatic situation, something you're trying to work through. But to complete the dream, so I'm trying to think of a couple of clients that I did the imagery rehearsal with. So one guy, his recurring dream was that he was in a car park that was empty late at night, and his window was wound down, and a hand would come and grab him by the throat and strangle him. Not kill him though, just strangle him, like panic, and then he would wake up. So his dream completion, or imagery rehearsal, was what could he do to the end of it. Now, when you're dreaming, like I said, you know, your brain's working in a different way. Your imagination's on, your frontal lobe is off, and your limbic system that works on your emotions is really fired up. So your limbic system, it's probably only working 5% of the time during the day, but it's working 12% of the time in your dream. So what you can do with that imagination being on and the limbic system is you can create an additional part to the story. So the guy I worked with, his end of the story was he wound the window up, the hand fell off, and he chucked it out, not out the back of the window, chucked it onto the back seat. So that, and it was wriggling around for a little while, and then he was laughing, and he was looking out the window at the guy and saying, well, he said lots of swear words, but perhaps we're not allowed to do that on LinkedIn Live. And he drove off, and he stopped having the dream. But he had to write that new version out several times in as much detail as he did the other one. There's something about the power of 3. So writing it out 3 times, saying it out to himself 3 times would be a really useful way of doing it. And it went. For another person I worked with, it was more about, they were younger, they'd just gone to uni. She'd started having nightmares only when she was at uni. And the nightmare was about her being choking and not choking, like unhealthy on the floor and thrashing around. And other family members were just stood around watching and not doing anything, not reacting, not changing their reaction. And so her dream connection was she loved Harry Potter. So all of a sudden, Harry Potter came along and waved his Patronus and got this dementor that was suffocating her and making her thrash around on the floor to stop. And then all the family went into the kitchen and had a jolly chat. So you can create not monsters, you can create magical beings. You know, I've heard of people having like Batman come and save somebody. And I think we've got more stories for kids because, like I said, there are more nightmares for kids than there are for adults. I wonder whether that's why I got interested in sleep, because many years ago I had a nightmare about being in my bedroom and the bedroom being on fire. And my nana was very clever, and we talked about it. We talked about it loads. And she said to me, she said, you know what? Well, let's make it different. Let's have a fire escape plan. So we created a fire escape plan that was real. I could have got out my bedroom window if there was a fire, but I imagined it as well. So, and that nightmare went for me. So I think, you know, science is catching up really on and some probably clever ideas that have been passed down through generations.
It's very interesting. So, I mean, my take on it is, and I mean, correct me if you agree on this, it seems like if we look at dreams rather in a less mysterious way, just look at it in a kind of a logical sense, applying it to our real life, and then taking control of that. Like, so what can we learn from this? What can we do about it? And by also doing that, it actually also impacts our dreams. Like what we do in real life impacts what happens in our lives. So removing this mystery around it seems to be the best practical approach. And it seems to work.
And we know that sportsmen and sportswomen and people that have got a real high-flying task to complete, if they think about it and write it on a pad before they go to sleep, they can use their dreams to help solve it. So the next morning they might wake up with a solution. And in fact, what we know is that teenagers that dream about exams do better in the exams the next day than those that don't dream about exams. And if we can inject the right bits for our brains to be working on when we're asleep, how much better a performer can we be? You know, that thing about you say, Matt, often, you want to get the advantage, start using your dreams. But we didn't really know that we could do that before. You know, there's a lot more information that's out there now. You know, we're collecting a hell of a lot more data. We now know that people never dream about more than 5 characters. You're always the main person, and there's always an issue to work through or to solve. And it's never actually that bizarre that it doesn't have some connection in life. So, you know, the data's there already. But we've got some clever people, not clever people, some intriguing, interested people in dreams. So one lady collected data on her dreams throughout her whole of her life. So I think we had 60 or 70 years worth of data. And when you analysed it, it fell into the same ordinary categories. Oh my gosh, we're going to have a quick look at my notes of what the categories are. They're always about failure or physical aggression or accidents or being chased or your health. So, you know, it's not that unusual. If that helps answer that question, Matt.
Yeah, absolutely. And it's interesting what you mentioned about increasing performance. So I did read a study a long time ago, actually, where I think it was they made people play video games before going to sleep. And then they made people play video games in the morning, and they always saw an improvement in performance. But only if they played it until sleep. If they played it in the morning and then played it the next morning, nearly no difference. But if they play before bed and then play again in the morning, they saw like a 20% improvement. And it seems to be exactly the same. If you do something before bed, you dream about it, then you're more likely to find solutions for it, which you can apply.
Yeah, because your imagination has been switched on and your frontal lobe has been switched off. We also know, so yeah, there's tons of areas. So we also know that when people are going through a divorce, are in that post-divorce depression stage, if people dream about the divorce, they get over that stage quicker, or they don't even go into that stage virtually, than those that don't. So whether it be about performance that's very physical and demanding, or whether it be about performance in getting on with life, it can have those same benefits.
Interesting, because I think there's a lot of people who are saying, "Oh, before sleep, you need to fully relax and totally let yourself go," which is kind of part what I would recommend. But it's also not bad to think about what you're going to do tomorrow. If you've got things to worry about,
write it down.
Yeah, write it down and get it like clear in your mind, rather than just try and push these things away. And then you got the added benefit that you're probably more likely to dream about this problem. And so often, if I do wake up middle of the night or wake up early in the morning, I'm like, I'm going to do this.
Yeah. And you know what? There is loads of evidence out there how good journaling is for you. I'm sure both you and me have spoken on some LinkedIn posts about journaling and how beneficial it is, because it puts those issues to bed. But unlike we used to say, we're putting them to bed not because we want to forget them, but because we want our brain to be thinking about them in dream world, which is quite interesting. The word "put them to bed" is quite a common phrase that's used. In fact, it just reminds me, not my nana, but my grandma, years ago, she lost a relative, and she'd been given some inheritance, but it should have been split between 2 or 3 of them. I can't actually remember, but you've just reminded me. And she loved dreaming. She talked about her dreams all the time. And she came round to our house one day and she said, "Do you know what? I've just dreamt of a number. I think it might be my lost cousin that half this inheritance is due to." Shall I just phone it? We were like, that is wacky, Grandma. That's not going to happen. She goes, but it is a code, like the pre-code. Does look familiar. She found it and it wasn't. So somewhere in your brain, you know, it can pick things up that may be dormant that you hadn't. I don't think that would happen today. I don't know. We all keep the same mobile number, so it might happen today. But we don't know it, do we? We just press a button. I don't know anybody's number. So I don't think that would happen today.
We don't consciously know it, but maybe maybe in the back wiring there's something going on there. So it's,
but we don't wire it in, do we? Because we don't practice it. So I don't think we would. I think it's because the number was rehearsed enough that she would remember it and she'd be able to pull it forward. When you don't rehearse something, it doesn't. That's the other benefit about sleep, is in that deep sleep, our memories get, I was going to say entrenched or chosen. So I often talk about memory in sleep, about having an in tray that during the day, it's filled up that in tray with lots and lots of information, rubbish information, like what you had for your lunch or where you parked your car and stuff like that, what you wore. But there's some other really important information. And what sleep does, it looks at everything in the in tray, puts a load in the bin and puts a load in several different filing cabinets. And so the next day, your in tray is empty to take on more information. So if it will have been that you knew how to type it once, it won't have gone anywhere. I think by the time you've typed it in 3 or 4 times, your brain will be saying, actually, this is an important number. I'm going to start storing it. Does that make sense? Yeah.
It does. It does. So I got a question I imagine gets asked a lot and it gets a lot of interest, and that's about lucid dreaming. So is it something you know much about? Is it something that gets touched upon? Because it's, I'm curious.
I don't know a lot about it. I haven't got any clients that have been lucid dreamers. I know a few lucid dreamers, and I've read a little bit about it. And a lucid dreamer can get better at it as well. And you can become a lucid dreamer, but there are very specific practices that I can't outline that would help you do it. But it will be some of those things about what you do before you go to sleep. From what I remember is there's the spoon test that we might often use to work out how long it takes for you to fall off to sleep. Have you heard of the spoon test?
I haven't. No.
Okay, so when you're trying to work out whether you're sleep deprived or not, you want to work out how long it takes you to get off to sleep. Because I don't know if you've recognised that the more sleep deprived you are, the quicker you can get off to sleep. You're like, oh my God, it needs it. It's not going to take me the usual 15 minutes. If you're struggling with your sleep, it might take you 30 minutes. Some people I work with, it takes them 2-4 hours. So it's big issues. But to work it out rather than clock watching, because that's not helpful, just to do it once only, is to go to bed, have on the floor a tray or something metal and hold a spoon so that when you fall asleep, your muscle tone goes and the spoon drops on the tray. And then that's how long you'll know it will have taken you to fall asleep. So I think in the lucid dreaming, they use that because then you can begin to access what your dreams are like. Because like I said, dreaming doesn't just happen in REM. Smaller, less intense versions happen earlier on. So I think that's one of the quick ways into lucid dreaming. But I don't think it's important. The facts are showing us at the moment that whether you lucid dream or ordinary dream, it's just one is as good as the other. And in fact, there are some concerns about if you can lucid dream and you can change what you're dreaming about, then it might not be as beneficial emotionally for you because you won't be open laterally to solve problems in many different ways. You'll be trying to control it in some way. So actually, we think that probably doing more lucid dreaming probably isn't a benefit, might be interesting, but might not actually help people. So yeah, I would perhaps say to people not to get obsessed with that bit about it, just to be curious about your dreams and to log them when you can, so that they can help you during the day, and to try and enter them before you go to sleep, or influence them, should I say, not enter them before you go to sleep.
I certainly think two key takeaways for me at the moment is obviously the importance of kind of what you do before sleep and its impacts on your dreams and the benefit you can get from that if you're in the right mindset. And then also just seeing dreams and nightmares in a kind of more logical like seeing it as it's a kind of link to your real life rather than seeing it as something mysterious, and you can also benefit in that regard.
Yeah.
I'd like to ask you about night terrors, because I'm of the understanding they're different to dreams. So what is the difference?
Okay, so a night terror is not when you're in REM sleep. So REM sleep, your body's paralyzed. The only thing that happens in REM sleep is your eyes are moving, your body's paralyzed. However, in night terrors, you're not in REM sleep, you're in the stage before. Remember that deep dive? And the deepest level is called deep sleep. And that's where night terrors will happen, sleepwalking or sleep talking will happen. So your body can still move, you can still shout out. That's why you can scream, and that's why you think it's a night terror. However, the person will not remember it, that they won't even know they're doing it. Often it takes a bed partner or a family member or a friend that's living in the same house to tap them on the shoulder, and then they will tell you about it. But and sometimes they can't even remember the detail about it. And often we say, don't wake them up if you can, unless they're in danger. Just let it take its course, because the next morning they won't even remember the detail. It won't matter to them, and it won't have mattered. The main thing is to try and get through deep sleep and into REM sleep, and then start the next cycle. So waking them up is no benefit whatsoever unless they're hurting you. I mean, I'm working with a guy at the moment that has about 8 or 9, and we're trying to work out whether they are night terrors, because he's twitching and flipping his arms around in the bed, but he doesn't know what it is. So to work out, not only is it a night terror, or is it restless leg syndrome, periodic limb movement. So we need to do quite a lot of analysis to help somebody. But night terrors, if somebody is actually having them, then do ask the partners, the people around them, try not to wake them up. But it's a sign sometimes that they are sleep deprived, or they are drinking too much caffeine, whether that be in coffee or whatever form. Quite often it can be Coke, or nicotine or alcohol. All those things make it worse, and sometimes the night terrors go away. And the other forms of parasomnia, like sleepwalking and sleep talking, if you can control those, you get better sleep, better quality sleep, better amount of sleep, and reduce those other things impacting, then quite often they go away.
Interesting. I've done sleepwalking once that I can remember. I don't remember it. I was just told it. But
was it as a child or as an adult?
It was as a semi-adult, like university time. So I'd been drinking quite a lot and I'd come home quite late from nightclubs. So that's the only time. So it makes sense that the alcohol probably messed up something in my head, and it creates some sort of episode of sleepwalking.
Yeah, but what I forgot to say then, the other factor is stress. So starting uni can be quite stressful. Although great fun, it can still be really stressful, being away from home, lots of exam results, exam and assessments going on. And so, one lady I worked with could be quite violent. So we would choose for her to be as safe and to get through the dream, the night terror, and into the next day. So she would sleep on her own. We make sure the room was as safe as possible. Her husband wouldn't sleep with her during the time she was having night terrors, and we tried to reduce her stress as much as possible and her sleep deprivation. So she had the occasions maybe once or twice a year rather than regularly every month. And we also created a risk plan. So what would he do when things got really, really risky? So he felt better about supporting her.
Interesting. So it seems like a lot of the areas in terms of dealing with dreams, nightmares, night terrors, sleepwalking, it is just about addressing what you're doing during the day, ultimately. And it sounds like it's not a case of like take this pill or you need this operation. It's just it seems to always be a psychological link to it, at least from what I understand. So.
Yeah, but there are times when it would be useful to get yourself assessed, because if when you're dreaming in REM sleep, you do have body movement as well that wouldn't normally happen, then that could be a sign of some specific physical health problems. So sometimes we have to be a little bit careful, and if it continues for a long length of time, don't think, if you've used these general strategies I've given you, you just have to put up with it. No, go and get yourself assessed. There might be some other things, because like restless leg, it could be an iron deficiency. something as simple as that that's causing the problem. So making sure you go and see a specialist that really gives you a holistic checkup to get to solve some of the problems that might be going on. Because we're all one being, you know, our brain's not separate when it's sleeping from our body during the day. They closely interact. And what we find that when we're asleep, our brain is more active than when it is during the day, and more integration. So actually, you know, sometimes the sleep issues are a clear indication of some of the things that are happening bodily to yourself as well.
Interesting. And on a note, we touched upon this just before we started, and we didn't have time to probably delve into it. But I know when I've had a lot of sleep apnea issues, because I've got like very mild sleep apnea, and I know a lot of other people, and I've spoken to apnea experts on this. Potentially, a common symptom is where you are dreaming or having a nightmare of choking or drowning, or you can't breathe, and it's always, a lot of people think, oh, it's just a nightmare dream, but it seems so common in people's sleep apnea that we're like, is it a dream or is it actually just sleep apnea? So I'm curious to get your thoughts around this.
So if somebody is dreaming about drowning, then that is very unlikely to be about the sleep apnea, as far as I can see. That the drowning, I get that it might be a sense of breathlessness. So it might be that you're dreaming about your breathlessness because you know that it's a problem and it's something you need to work on, and that you might, so your brain might be trying to find another solution to the sleep apnea you've got. So I think there could be connections in a bit in the similar way that we have a condition called COMISA, that when people have sleep apnea, they also have a 30% chance of having insomnia. So we call it the comorbidity of sleep apnea and insomnia. And you can imagine it can go either way. You can have insomnia and then you go on to have sleep apnea. We can have sleep apnea and you get really stressed about your sleep and then you start getting insomnia on top of it. And I think the same can happen with that dream. You might start dreaming, trying to solve the sleep apnea in your dreams with other solutions. And there are other solutions to the kit. So some people really do not like wearing the CPAP kit that you need to wear for sleep apnea. And there are other solutions. So your brain's perhaps trying to think through or apply some of those other solutions. You know, there's weight control, there's better breathing that you can do, position in bed, lots dental kit that can be used. All of those would be really useful. But maybe it's a way of your body saying, I need to work through it.
Interesting. I mean, certainly, I guess the overall way of seeing it is if you are having dreams of choking or not being able to breathe, and it's combined with snoring or other classical signs of sleep apnea, then, as I said earlier, it's definitely worth getting checked and seeing some specialists about that.
And Matt, has anybody shared on your podcasts and LinkedIn Lives about the acronym called Stop Bang?
Yeah, we talk about Stop Bang. So it definitely, it's always like first port of call I recommend people. Good. So for any viewers, it's a very simple quiz. It takes less than 60 seconds. And if you score 3 points or more, then you should at least explore it. It's very simple though.
Yeah, it's 4 or above. And if it's 5, definitely.
Yeah.
And anaesthetists use it. So when somebody's being assessed by an anaesthetist, if they score 4 and above, they might be considering what do we need to do to improve their breathing when they're asleep so that this operation goes fine. So often, I was a sleep consultant in Manchester Sleep Service for quite a while, and we'd get referrals from an anaesthetist quite often to try and help with that issue.
Interesting.
Yeah, but it's true. Yeah. Getting assessed, but also that Stop Bang's not as good as assessing women. So women need to be careful with a lower score, like you said.
I talked to Audrey Wells about this, and I think there's issues. First, I think some of apparently home sleep tests aren't as good at measuring women's sleep as they are men's. Yeah. So it's a case of they can give a lot of negative results when apnea is actually there. And obviously, generally the clinical information on women's sleep is quite a bit behind than it is for men.
Yeah, and it's really interesting from a dream point of view. Men dream about men, and women dream about men and women.
You need to explain more on that.
I don't know. We don't know why. We have no idea why that happens, and we're no idea about, so if we even analysed different types of people, like transgender, gay and lesbian people, whether they dream differently, different communities, whether that would influence whether men dream about men and women dream about men and women. It will be interesting. It's just a fact that's been researched and found throughout several different communities.
Interesting. I've got more questions and answers today. I'll go on to some research.
And you know what? It's like me know, Matt. It's such a new area, sleep, isn't it? The research is really small on the very basics. Never mind the more complex, nuanced bits. So yeah, we might find we change what we say in another 10, 15 years.
With sleep, the more I learn, the less I know at times. Like, I went into a bit of a rage a few days ago about one thing, which is that this is one example of many where people really pushing magnesium, for example. So you've got to take magnesium, like this is the type you do for this, and this is the type. And then I just thought, okay, I'm going to actually look at the studies. And I was like, there are hardly any. And the ones that are there were for magnesium oxide, not for magnesium glycinate. And it was on a group of 50 people. And I was just like, and this is like the best study we have on it. And it's just like, and the claims made by supplement companies based on extremely mediocre information is wild.
So I was just on a training session, like I said before, Matt, on restless leg with one of the top experts in England. I take part in these monthly seminars to make sure I'm up to date. And she was saying that for restless leg, there's lots of things that you need to do and that need to be assessed by an expert. But what people couldn't saying to her is saying that magnesium seems to help. So she said she couldn't find any evidence that would suggest it. So she says, I don't advise it to people in the clinic, but people, if they find it useful, do it. So we don't know. We have got no research at the moment that looks at where the placebo effect of it, that bit where just doing something, having a false tablet, actually begins to have an effect. And
that's the thing, like any tablet, as long as it's not doing danger, can in theory help sleep if you think it's going to help you sleep.
And you know what? We do know that a high proportion of the population, I'm not trying to think how high it is. Sorry, I don't know the figure, is magnesium deprived. So it's not a bad thing to do.
So you can't, it's not bad advice. It's just, I don't think that people giving the advice often realize how little evidence backs what they're saying. And that's the area that very much surprises me.
And I also think it makes people feel hopeless and helpless when they try something and it doesn't work again without getting the right advice for them personally. So that bit about knowing what that individual you're talking to needs to work on, without that knowledge, there's something like, I don't know, it's probably over 1,000 pieces of random stuff that helps people sleep. But unless you know that person's circumstances and their health and their sleep issue, you can't take out of that tool bag the right ones that help that individual. We've got a whole tool in England called Sleepio, which is a computerized version of cognitive behavior therapy for insomnia. And the number of clients I get where I've gone, doesn't work for me. And when we've looked at what their issues are, I was like, oh my God, no wonder it didn't work. Because like all CBTI, whether it be virtual or not, they always load it heavily with sleep restriction first and work through getting somebody to, and actually for that person, their circumstances, sleep restriction wasn't possible. So they already started to feel hopeless and helpless even before they got the package. So I just hope in the future we get better at telling people what to do when, rather than just what to do generally.
Treat the cause, not the symptom. But I appreciate systems. It's hard to do personalized medicine, so I appreciate it's a balance. So a few people have just been saying how interesting it is. I know Jocelyn's saying super interesting. I don't think we had any direct questions, so I'm a little bit tight. I think we're both a bit tight in time. I do have one quick question to leave on, which we didn't cover, which is, do you have much insight on sleep paralysis? So, for example, it's less common now, but historically I've had issues where I've kind of been awake but can't move. and I'm struggling to breathe. I'm like, and it's quite scary.
Yes.
And I'm just wondering if you have any advice for people on that.
Yeah, so it is more common when somebody's had an anaesthetic or an operation. It's more likely to happen. So I don't know if that had happened to you, Matt, before it happened for a while. But yeah, it happens because, so just knowing the education about why it happens is really important, because once you know why it happens, then when you don't panic when it's happening to you as much. And it happens because when we're in REM sleep, like I said before, our eyes move and our diaphragm moves to help us breathe. But the rest of our body, our limbs are really floppy. If you carry a child to bed or out of a car into the house, sometimes they're incredibly floppy. And that's because all their muscle tone is gone, because they've gone to sleep and everything's just like all muscle tone is gone. And what's happened in sleep paralysis is they've woken up psychologically, but their body hasn't caught up. So it takes just a few seconds for the body to catch up. But because when we're dreaming, sense of time and sleeping, sense of time isn't so acute, then sometimes those few seconds can feel like a lot longer. And knowing that information can make, and if you add that again into your knowledge before you go to sleep, when it does happen, the panic happens less often, and it usually rectifies itself like it did for you after a few months.
Interesting. So I may have to invite you back again in the future, Jill. So I really appreciate that. For those who are watching, either now or post production, how can they best reach out to you and contact you?
Well, the best way, if you've got a very specific personal problem, is I do 15 minutes consultations on a Thursday morning, so you can book into one. You can either do that via the LinkedIn messaging, and we'll just find a slot that works for both you and me. So I'm on LinkedIn as Dr. Jill with a J, McGarry. So that's McGarry. Just send me a message and I'll respond to it. I've also got a webpage and a company. So that's www.sleepbetterdoctor.co.uk. So nice and simple.
Very nice. Awesome. So if anyone has questions, you know what to do. And yeah, we'll put an end to the stream.